This is a holiday weekend. I'm going to celebrate it. There's great things happening. Economy's growing faster than any time in 40 years. We've got a record number of new jobs. COVID deaths are down 90%. Wages are up faster than any time in 15 years. We're bringing our troops home. We have all across America, people are going to ball games and doing good things.
President Biden on Friday reminded Americans of the stark differences between our Independence Day celebrations this year compared with those in 2020. Last year, the country was in lockdown with an average of more than 50,000 new cases and more than 600 deaths each day. This year, the numbers have drastically and dramatically improved, with an average of around 13,000 new cases and just over 200 deaths a day. That is something to celebrate. Yet there's still danger on the horizon in the form of the highly contagious Delta variant. Joining me now, Dr. Michael Osterholm, who was a member of the Biden Transition COVID-19 Advisory Board and is the director of the Center for Infectious Disease Research and Policy at the Great University of Minnesota. Dr. Osterholm, thank you very much for coming to the Sunday show.
Thank you. It's always good to be with you, Jonathan.
All right. So the President Biden had this goal of having 70% of the country vaccinated by this date. Unfortunately, that goal was not met. But is it a failure to say, but is it right to say it's a missed deadline or a missed goal when you know that 67% of the American people have received at least one shot?
You know, what's happened over the course of the last 7 to 8 months in this country has been nothing short of a modern public health miracle. Bringing these vaccines forward and getting us to the vaccination levels we're at has really been a major accomplishment, and I give the administration great credit for that. But the problem is that we can't set our goals based on some arbitrary number. We have to set them on what is going to make a difference in stopping the transmission of this virus. In the past week, 20 states have seen 20% or more increase in cases, largely tied to this new Delta variant. So even trying to get 70% of the population vaccinated with a single dose is not going to be enough to really stop the impact of this virus in our country. And we need to wake up and recognize that.
How worried should we be about this Delta variant, Dr. Osterholm? Because we're seeing in parts of the country where the vaccination rates are low, hospitalizations and COVID case positivity rates are going up.
Well, we have to understand, first of all, that we have many parts of this country that have had very limited vaccination. You know, when we talk about a number, it's kind of like your head's in the freezer and your feet are in the oven and average your temperature is just right. This is what we have. We have over 1,000 right. counties in this country that have fewer than 30% vaccinated. We have 4 states that have less than 40% single-dose vaccination as states. And we have an additional 20 states for which we actually don't even have 40% with one dose. So I think that the challenge we have right now is, in fact, helping people to understand why these vaccines are so critical. If this virus is in your community, it will find you. And it is in every community. So that means you have to be prepared to get infected if you're not going to get vaccinated. And I don't think a lot of people realize that at this point.
Dr. Osterholm, let's bring in Laurie Garrett, Pulitzer Prize-winning journalist, MSNBC science contributor, and author of The Coming Plague. Laurie, great to see you. Happy 4th of July. Let me bring you into the conversation and get your view on where we are as a country. We didn't meet the president's goal of 70% of the American people being vaccinated. It's 67%. So do you think that our vaccination efforts are going as well as they should be?
No, of course not. And obviously, I agree with Dr. Osterholm on all of this. The real problem we have right now, according to the brand new Washington Post poll, is that we have about 29% of the American people saying, I'm probably not going to get vaccinated, and 9% saying, I absolutely won't get vaccinated. And these may not be in your neighborhood. They may not be people in your community, because this is also skewed to specific areas geographically and politically. Republicans are far less likely to get vaccinated. The differential is astounding. 86% of Democrats say they will get vaccinated, but only about 47% of Republicans say so. So what we're seeing now is this terrible skewing where in certain parts of America, where you have a high concentration of Republicans, Republican government leadership, you have very low vaccination rates and simultaneously the arrival of the Delta variant. So this Delta variant, and people have got to take this variant seriously. This is not just some weird phrase. It really is a substantially more contagious and substantially more dangerous form of the COVID-19 virus. It is now concentrating in the areas with the lowest vaccination rates. So we have this perfect storm happening right now with political and social reluctance to get vaccinated, coupled with the arrival of precisely the reason you should get vaccinated, a strain of the virus that is much more dangerous. And then the final data point, Jonathan, is that almost 100%, 99.5% of all deaths in America to this virus right now are unvaccinated individuals.
And Dr. Osterholm, that gets to a question I was just about to ask you, and that is, if you are vaccinated, meaning double vaccinated, you've gotten both of your shots, like I and my husband have, how worried should we be? How worried should the vaccinated be about this Delta variant?
Well, frankly, the vaccines we call the mRNA vaccines, the Pfizer and Moderna vaccine, are performing very, very well. With one dose, they surely can reduce the severity of illness and the likelihood of hospitalizations. But with two doses, we're actually seeing quite good protection even against milder illness and definitely against serious illness and hospitalizations. So get it. I think there's still some questions about the J&J vaccine, although we've had good news this past week about the possibility that the antibody is going to be protective after one dose. I, like many of my colleagues right now, are saying we surely need more information quickly as to just how well that's going to work. But the bottom line is you can't use the variant as the reason not to get vaccinated. You should use this variant issue as the reason to get vaccinated. And if you don't believe that, go look at places like Missouri and Arkansas right now, where they're seeing the highest number of cases admitted to their intensive care units they've had at any time during the pandemic. Will that play out in other parts of the country? We don't know. But I can surely tell you this, we have a lot of places in the United States that are just as vulnerable, if not more vulnerable, to this kind of situation as we see right now in Missouri and Arkansas.
Mm-hmm. And Lori, let me get you real quickly in the less minute that we have left. There's a story in the New York Times with the headline, "Masks Again, Delta Variant Spread Prompts Reconsideration of Precautions." And it talks about how Los Angeles County and the World Health Organization warned that even immunized people should wear masks indoors. Some scientists agreed, but urged a localized approach. Real quickly, your reaction to that. Should we be wearing masks again?
This is obviously a moment of great confusion about how protective the vaccines are. The one data point I would look at is that we have 180 million vaccine doses administered or fully vaccinated Americans, and only 4,000 and change have had breakthrough infections. So what that tells you is the vaccines, if properly administered and fully dosed, really do protect you. And on the other hand, I personally always wear a mask when I'm in a public space.